The unprecedented lockdown in Wuhan, China, lifted at the stroke of midnight on April 8th. The city of Wuhan, where the COVID-19 pandemic began, has reopened to the world. In this is a hope, not just for China, but for the entire world battling the coronavirus outbreak. With its widespread testing, severe restrictions on movement, social distancing, and the use of technology, China managed to flatten the curve and significantly slow the spread of the coronavirus. This is Beyond the Headlines, and I'm your host, Sohail Akram. In this episode, we look at how China brought the coronavirus outbreak under control in just 100 days and what lessons can be learned from it. For 11 weeks, Wuhan was a ghost town. But now people are being allowed out of their homes and businesses are slowly reopening. According to local media, within hours of the lockdown ending, roughly 65,000 people had left the city by trains and planes. Many of them had come to visit relatives during the Lunar New Year holiday in late January and were stranded when the coronavirus lockdown was announced. These are hundreds of medical workers at an airport in Wuhan, singing and sobbing at the same time, saying farewell to their colleagues as they prepare to fly home. Thousands of healthcare workers were flown in to help with the outbreak, and now they can finally return home. Wuhan's residents are now also permitted to leave without special authorization, as long as a mandatory smartphone application and a mix of data tracking shows they are healthy and have not been in recent contact with anyone confirmed to have the virus. But not everything in the city is healed. It suffered immense pain and thousands of deaths. As it opens up, the world is watching this recovery. The end of lockdown in Wuhan came after only 3 new coronavirus cases were reported in the city in the previous 3 weeks, and a day after China reported no new deaths for the first time since they began reporting. These are signs of progress, but suspicions linger that the Communist Party government in China is intentionally underreporting the real number of deaths and infections. US President Donald Trump recently questioned China's death toll and infection rates.
Their numbers seem to be a little bit on the light side, and I'm being nice when I say that, relative to what we witnessed and what was reported.
According to the New York Times, China for weeks flouted the World Health Organization recommendation that countries include asymptomatic patients in their official counts. But as public pressure mounted, Chinese officials began partially reporting the asymptomatic patients from April 1st. China has denied these suggestions. The country has a history of accusations for underreporting disease outbreaks. During the SARS outbreak of 2002, the Chinese government was called out for its attempts to cover up the outbreak, which eventually infected around 8,000 people and killed nearly 800. And yet, while the optimism is edged with caution, Wuhan is open again. Despite the city's new freedoms, there are still a number of prevention measures in place. Wearing masks, temperature checks, and limiting access to residential communities remains in place. And people leaving the city will face numerous hurdles, such as 14-day quarantines and tests at their destinations. We spoke to Dr. Shi Chen, Assistant Professor of Public Health at Yale School of Medicine and a China expert, to hear his perspective about how China controlled the virus early on.
Starting from December the 8th, there were some cases first identified as people having a fever, but those are the number like over time. So it's not like all coming out at the same time. So it's really hard for all human societies to identify situations like that, because we need to judge whether this is a threat to the human society or it is a very local issue. So that took a while for them, the local health authorities, to identify the risk until, I believe, until January the 11th. So before that, they try to be precautious. They tried to close the seafood market because they believed that the seafood market was linked to this infections. We know that by January the 11th, that was a massive movement of people walking the east coast to west inland, and that was we call the 春运 period, which is the spring festival travel season. Usually, like around 8 billion people times they travel across the country. So that was really bad timing because that may accelerate the infection of virus. Since then, the transmission was ongoing throughout China, not only restricted to Wuhan. Since this is a very unknown threat, so a lot of events were still ongoing. For example, there were like 10,000 people's banquet right before the Spring Festival, and there was some official sponsored tourism events in Wuhan, which also attracted more than a few thousands. So that was a large social gathering. But things changed dramatically after January the 20th, when China's major scholar Zhong Nanshan was confirming throughout the media there was a human-to-human transmission. I think that was the key date when they realized this is a large-scale transmission ongoing. After confirmation, it only took like 2 and 3 days for China to decide to have a lockdown at the epicenter, Wuhan. So they locked down around 13 cities, which on average had about 6 million population. So overall, it's like twice the population size of Canada being locked down within a few days.
As the number of positive cases started surging, China wasted no time. It quickly built makeshift hospitals in Wuhan to house the patients. By February 28, Wuhan had created 16 temporary hospitals, adding 13,000 beds, with 12,000 people treated so far. Overall, the number of Wuhan hospital beds rose from 5,000 to 23,000. And that, according to Dr. Shi, was a very critical step.
In China, in Wuhan alone, they built 13 makeshift hospitals. Each can host about 2,000, 3,000 people. So they can put so people with lighter symptoms in that facility, and the healthcare workers can take care of them. If they are like getting worse, then they are going to be transported to some major hospitals. And China also built 2 hospitals to treat those severely ill patients. So one is called Leishenshan, the other is Huoshenshan. Those 2 hospitals were built within 10 days. But I know it's very different culture, very difficult to make this arrangement in the US because as far as I know, my American friends, they have concern about their free choice, freedom, and their privacy. So they do not really like the idea of being put in a makeshift hospital, because that didn't happen anytime in their throughout their lifetime. So it's a new experience they have to adopt.
Chinese disease control officials said in January that the virus likely came from wildlife to humans at a Wuhan market that sold wild animals for food. Experts believe it was bats before an intermediary animal passed it on to humans. As the virus spreads rapidly around the globe, nearly half of humanity has been forced into some form of lockdown. Wuhan's unprecedented lockdown has become a model for countries around the world trying to stop the spread of the COVID-19.
Well, the early reaction from the Chinese citizens, who are quite compliant and, listen to what their government tell them, they were very compliant.
This is Raymond Ferguson, an Irish national who lives in China's Guangzhou city.
The first time that the news started to come out around the 20th of January, that was over the period of the Spring Festival time here, which is the big holiday for Chinese people. Many migrant workers at that time would return back to their home villages and hometowns to spend that 10, 14-day holiday with their family. And normally it's a time for getting together and eating dinner, obviously, with your family and socializing with your family. But none of that happened this year, um, which was quite bizarre because, as I say, it's the main big holiday and possibly the only holiday that many Chinese get, within the space of a year. My first initial reaction was, ah, this will all blow over. It's nothing to get really serious about. I was looking at the numbers and things like that. That was obviously maybe being a little bit dismissive, but that's the way I am anyway. And I kind of take everything in my stride. But then as time started to go on, and as more stringent measures began to be taken, and you know, hearing then just on the news and from the Chinese locals themselves that they were quite, alarmed about this, obviously, and especially whenever the government then started to, close all the public areas and announcing people should be staying at home and not going out unnecessarily. And if you do have to go out, wear a mask. So, as time has gone on, and now obviously, whenever I look at the rest of the world, it's something that everybody should be taking seriously.
And without a COVID-19 vaccine, more and more countries are going for stringent curfew and lockdowns. Still, the World Health Organization doesn't think it is enough.
These society-wide measures are difficult. They are not easy, and they are hurting people. But the alternative is even worse. And countries, if they're going to be able to move away from this approach of having to lock down and shut down, if we're going to move away from that approach as a means of suppressing the virus, we have got to put in place the public health surveillance, the isolation, the quarantine, the case finding, the detection. We have got to be able to show that we can go after the virus, because lockdowns alone will not work. But unfortunately, in some situations right now, they're the only measure that governments can actually take to slow down this virus.
That was Mike Ryan from the World Health Organization's Emergencies Program. But China's restrictions go beyond the lockdown. Testing remains an important factor in curbing the spread. On April 6, the Chinese government said that those travelers who try to hide their travel history or health condition can face a fine of over $4,000 or even criminal proceedings. It said such people would be placed on a customs blacklist of travelers who would be subject to tighter checks in future. Back in the southern city of Guangzhou, where Raymond lives, he describes some of these strict measures that the government is taking, sometimes having people's temperature taken at least 5 to 10 times a day.
You had to get your temperature taken, and even yet, that's still the case with all the supermarkets and any restaurants that are open. Keep the mask on, obviously, whenever you're not eating or drinking, and you have to kind of keep a distance. Well, the restaurant has to put these measures in place that you have to keep a distance of about 1 to 2 meters away from the next person. So those are just the day-to-day things. I live in a gated community here. I have to get my temperature taken before I'm allowed into the community. I have to get my temperature taken again before I'm allowed into the actual apartment building where I live. So day to day, just on a normal day out for me, I am getting my temperature taken at least 5 to 10 times, depending on how many shops I go into.
One of the important tools that China is using in its fight against the virus is technology. There have been numerous reports of how China is using a health code app to curb the spread of the virus. This mobile phone app has been a success, if intrusive experiment so far. It helps the government distinguish the sick from the healthy. The app tells its users if they have been near a person who has been confirmed or suspected of having the virus. We asked Raymond if he has the app on his phone.
Well, there was one app, it's called Suikang, it's Suikang, and everyone, whether a foreigner or a local, if they moved from one province to another, then they had to update. Basically, it would have asked where you had come from, what your current health status is, Do you feel okay, etc. And as I say, I lived in a gated community, and they would have like a QR code there that you would have to scan in order to download that information and fill it out right on the spot. So once you would fill it out once, then if you were going into somewhere that required a sway can, then you would just show the app that you've already downloaded, and the information that you posted at that time would be scanned, and then you would have free passage then. But that was definitely one thing that everyone here had to download and had to use, basically.
But how exactly does this app work? Here's what the Human Rights Watch website says. People first fill in their information, including their ID number, where they live, whether they have been with people carrying the virus, and their symptoms. The app then churns out one of the three colors. Green means they can go anywhere. Yellow and red means 7 and 14-day quarantine, respectively. The app also surreptitiously collects and shares with the police people's location data. Outside China, the situation is now worse. As of April 9th, global coronavirus cases have exceeded 1.5 million. Italy, hit hard by the virus, has announced they may soon start to slowly lift restrictions. The United States has more than 430,000 confirmed cases, the highest number in the world. France has officially registered more than 10,000 deaths from coronavirus infections, making it the fourth country to cross that threshold after Italy, Spain, and the United States. Wuhan is no longer the center of the crisis. Now it's the United States. As of April 8th, New York State, with 149,316 confirmed cases, has had more people test positive than any other country in the world. Ajlan Al-Zaki is a UAE doctor at the Stanford University Hospital in California. He says that despite the early warning signs from China, the US missed a chance to stop the spread of the virus.
I think we definitely were given warning signs from what we saw take place in China, what we saw take place in Italy. I mean, they have had tremendous casualties from infections or people being infected with coronavirus. I think one of the biggest limitations in the US was really when we learned about these infections in China and in Europe, developing testing capabilities and really expanding the hospital capacity to handle increased patient loads, especially in the intensive care unit.
As the positive cases in the United States surge daily, are there any takeaways from China that the US can implement? Here is Dr. Shi again.
I think it's very important to do the contact tracing and identifying people with asymptomatic cases. Now the testing kits is not in a shortage. Now they should continue to aggressively testing people, because we know for this disease, more than 60% of people may be asymptomatic, but there are already some clinical cases showing that asymptomatic cases can be transmitting or spreading the virus. So now the issue in America is still testing capacity in many places, because we see that in many places the positive rates are still very high. Like the testing, identification, isolation should still be ongoing. And at the same time, I think US and China and other countries should work together to accelerate or to shorten the time period of the antiviral drug research and development, and also trying to find in a even longer term vaccine, because there's a large chance that this virus may go back in the fall season or early next year.
These are unprecedented times. The COVID-19 pandemic has tested the world. Resolves of governments are being tested, as is the resilience of the people.
I would just hope that people could listen and take a little bit of advice and my personal anecdotes from here, and just do what is asked of them socially, and be safe, but keep your distance for a while, and just try and help one another out through this difficult time that everyone is experiencing. And I think, and I hope, hopefully, if everybody do that, then we'll come out at the other end of this a lot quicker, and hopefully a lot better people at the end of it, personally to one another, whether no matter what religion you are or what language you speak or where in the world you live, I just hope that, you know, humanity-wise, we can learn a lesson from this and start focusing on the real things that matter in life.
Thanks this week to Dr. Shi Chen from Yale and Raymond Ferguson. Thanks also to Dr. Ajlan Al-Zaki from Stanford. I've been your host, Sohail Akram, and you have been listening to Beyond the Headlines. We were produced this week remotely by Arthur Edison and Aisha Khan. If you enjoyed this episode, feel free to drop us a review and hit the subscribe button on your favorite podcasting app. Stay safe.